to Medical Dialogues. I'm Roshni Dhal. Let's look at today's top headlines. The weekly cases up 29% as COVID hits more states. India lodged a 79% increase in COVID-19 cases in the week ending Sunday with a tally of over 36,000, the highest weekly count in nearly 7 months, as infections began spreading in states where cases were relatively few till the previous week. COVID deaths continued to be low, although the toll was inching up. It recorded 68 fatalities during the week, up from 41 in previous week. COVID jab Covovax as heterologous booster to be available on CoWIN soon and cost Rs 225 per dose. In view of the rising cases of COVID-19 in various parts of the country, Union Health Minister Mansukh Mandaviya is learned to have approved the inclusion of Serum Institute's Covovax on the CoWIN portal as a heterologous booster dose for adults. Covovax is likely to be available on the portal in a few days at a price of Rs 225 per dose plus applicable GST. Doctor had casual approach towards minor patient. Consumer Court holds Paediatrician guilty of medical negligence. Upholding the court of the State Consumer Court, Maharashtra, NCDRC has held a Thane-based paediatrician guilty of medical negligence while treating a minor patient of 2.5 years of age. The child suffering from pneumonia expired and the treating pediatrician was held guilty by the Maharashtra State Commission. While the doctor challenged the order, the NCDRC bench observed that the doctor had a casual approach towards the patient, holding that the doctor failed in his duty of care and also observing that the medical record was not consistent with the treatment given or maintained properly. The NCDRC bench noted that the child was deprived of proper treatment at OP's hospital, thus it was the act of omission. Accordingly, we hold liable for medical negligence. With this observation, the top consumer court upheld the order issued by the State Consumer Court and dismissed the appeal by the doctor. COVID-19 spread from mothers to babies in womb caused brain damage, according to a study. 2 babies born to mothers with positive COVID-19 diagnosis suffered brain damage in the first confirmed cases of the disease spreading through the placenta, a new study found. The 2 babies were born to different mothers at the neonatal intensive care unit at Hall's Children's Hospital at the University of Miami Jackson Memorial Medical Center. Both babies tested negative for the virus at birth but had high levels of COVID-19 antibodies. The infants suffered seizures, developmental delays, and had small head sizes after birth. The University of Miami said in a release, one of the babies died at 13 months old. The research conducted by researchers at the University of Miami was published in the Journal of Paediatrics. 11th April is celebrated as World Parkinson's Disease Day. Parkinson's disease is a degenerative disorder that can affect the way you perform your day-to-day activities. It's more difficult to understand than you think. Parkinson's disease is more difficult to manage than you think. While you use your voice or facial expressions to convey what you want to say, people with this brain disorder are not able to communicate like that. At times, it can get a little difficult to understand what people with Parkinson's are trying to say. World Parkinson's Day is celebrated every year on 11th of April. This day commemorates Dr. James Parkinson's birthday, the man who wrote an essay on the shaking palsy in 1817, the piece that first recognized Parkinson's as a medical condition. Parkinson's disease is a neurodegenerative disease which happens because of the deficiency of a chemical called dopamine in substantia nigra part of the brain. It is usually a disease of elderly, happens in the people who are more than 65 years of the age, but in few cases it is also seen in people less than 50 years of age. In these, it is called as a young onset Parkinson's disease. It is usually seen in people who have family history of having Parkinson's disease. Disease is generally associated with elderly, and the symptoms like tremor, stiffness, and difficulty in coordination is considered signs of an aging brain. However, the disease can have an early onset and even affect young people of less than 50 years. People who have young Parkinson's disease may not develop apparent behavioral changes or memory loss, which is usually seen in elderly patients. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.